Hello everyone, today we will teach you the radius bone, the bony features of the radius bone, side determination and the muscle attachment. Let's start. This is the radius bone of our forearm, lateral bone of the forearm, and it is homologous with the tibia of the lower limb. It has an upper end. This is the upper end of the bone. This one is the shaft of the bone and this one is the lower end of the bone. If we talk about the side determination of the radius bone, how we know this is the right side bone or the left side bone? The first point is that the upper end having a disc shape while the lower end expanded, and there is also the styloid process. Clear? And the second point is at the lower end, the interior surface in the form, there is a thick prominent ridge, and on the posterior side there is a radius tubercle of the lister. Clear? And the third point for the side determination is the sharpest border of the shaft is the medial border. This is the medial side of the bone and this is the lateral side of the bone. How we know? Because in the lateral side there is present the styloid process. Clear? So for the side determination, you know the medial border is the sharpest border that starts from the radial tuberosity till the ulnar notch. Now we start the bony features of the radius. We start from the head. We know there is a disc shaped head of the radius bone that is covered with the hyaline cartilage to attached with the capitulum of the humerus to make a elbow joint. Clear? And the second of the annular ligament to make a radio-ulnar joint. And this the disc of the head shape superiorly is a concave that make a joint with the elbow bone humerus. The neck of the radius is enclosed by a narrow lower margin of the annular ligament, and the head and the neck are free from capsular attachment and can rotate freely within the socket to perform a pronation and the supination movement. Next, there is just lie below the neck there is a tuberosity that is called the radial tuberosity that is medial to the neck, and it has a posterior surface is rough and the interior surface is the smooth. We discuss about the shaft, and there is a 3 border and the 3 surfaces. Clear? First we see the borders. There is interior border, medial border and the posterior border. Clear? So first we discuss the interior border. The interior border starts from the radial tuberosity to the oblique line towards the styloid process. Clear? So this is, you see, there is a interior border that runs from the radial tuberosity and close to the styloid process of the radius bone. Clear? And the second border is the medial border that runs from the radial tuberosity to the above the posterior margin of the ulnar notch, and this is the sharpest border of the radius and it is also called the introitious border. And then the posterior border is also gives mirror image to the interior border, because there is present the one most important structure that is called the radius tubercle of the lister. So this is the posterior border. Now we talk about the lower end of the radius. This is the widest part of the bone, and there is on the lateral side there is present the styloid process, and on the medial side there is present the ulnar notch. And this part have the 5 surfaces. First we talk about the interior surface. This is the interior surface. So on the interior surface there is present the thick prominent ridge, and it is also here we can also palpate the radial pulse through the radial artery. Clear? And this is the medial surface of the lower end. On the medial surface there is present the ulnar notch, and on the posterior surface there is present the dorsal tubercle of the lister, and there is present the 4 grooves. The lateral border, on the lateral border there is the styloid process, and on the inferior 5th side there is attachment of the scaphoid bone, and on the medial side there is the attachment of the lunate bone to make a wrist joint. The attachment of the radius bone, the posterior part of the radial tuberosity, there is a one muscle inserted that is called the bicep brachii muscle, and the second muscle insertion on the lateral surface. This is the lateral surface. So the upper part of the lateral surface, there is the one muscle inserted that is called the supinator muscle, and on the medial surface of the lateral surface, there is one muscle that is called the pronator teres, and on the lower part of the styloid process, there is the one muscle that is called the brachioradialis muscle. Radius bone, the two muscles originate. The first one is the flexure digitorum superficialis muscle that originates from the interior oblique line of the interior border. यहाँ से ये muscle originate हुआ है. And the second muscle that is called the flexure pollicis longus that is originate from the upper 2/3 of the interior surface. अगर हम क्लिनिकल की बात करें तो मोस्ट कॉमन that is called the Cooley's fracture, basically the distal end of the radius fracture. It commonly occur in adults and common in women because of postmenopausal osteoporosis.